Thank you so much for coming here as a part of this very, very important press conference. And we're here on the steps of Brooklyn Borough Hall.
Yay.
And we're so very grateful that our Brooklyn Borough President, the Honorable Eric Adams, is hosting this event with Amida Care, Doug Worth, whom we will be hearing from later, and I am C. Virginia Fields, whom you will be hearing from later. But for now, it is my pleasure to bring forward our Brooklyn Borough President, and just to say again, this is PrEP Awareness Week from the 20th to the 26th of this week. And this is a New York State initiative where across New York State, awareness about PrEP as a prevention to HIV transmission is being put on social media, street blitz, activities, press conference, all designed to help create awareness about the importance of PrEP, to educate our communities. And right here in Brooklyn, we still have one of the highest rates of new infections here in New York City. So that's why we are so grateful and appreciative of what the Borough President, the Honorable Eric Adams, continues to do to promote, to educate, and to engage the community. With that, it's my pleasure to bring forward Borough President of Brooklyn, Eric Adams.
Yeah.
Thank you so much. And a former borough president herself that really led the way on how to utilize one's office to improve the lives of those who are one's constituents, C. Virginia Fields. We want to thank you so much, the CEO of National Black Leadership Commission on Health. This is so important because it's about communication and getting the message out, and no one has done it better throughout these last few years. We have partnered on a number of events to raise awareness about HIV and AIDS. And Doug Worth, President and CEO of Amida Care, and we're looking forward to continue to push forward this conversation and letting people know that HIV and AIDS is not a death sentence as long as you take the proper precaution and the proper medical assistance that's available. And Dr. Jeffrey Birnbaum at SUNY Downstate Medical Center is also here. We want to thank him. Octavia Wheeler, Brooklyn community member, and various other groups and organizations that are here, and colleagues in government. We are all embracing this same conversation. And I think as CEO Virginia Fields stated, Brooklyn has become, unfortunately, the epicenter of not only the current crisis, but the new infection rates. And we want to be proactive in stopping the spread of AIDS and HIV and AIDS by information and what one can do to help stem the tide of this horrific disease. And this is not the first time our country has come up against those major infections. We fought with polio, we fought with other diseases in the past, so we know how it is to come together and come up with a solution. But solution starts with information and communications. If you look at the numbers, a little more than 2,000 new cases citywide. Brooklyn bears a disproportionate number of those cases. In this borough alone, 30,000 of our neighbors are living with HIV, and we want to send a loud message that, again, that does not have to be a death sentence. But it's clear that Brooklyn is the hardest hit. And that's why it is imperative that here on the steps of Brooklyn Borough Hall, the conversation must start here on our steps. The oldest governmental building here in the borough of Brooklyn. This is the best place to start this conversation. PrEP is a game-changing pill that has proven to be 99% effective in preventing HIV transmission. This is an amazing stat. And New York State recently announced a number of new HIV infection was down 11% from 2017 to 2018. And this shows the power of PrEP and what PrEP is doing. So we want to increase the usage of PrEP, to educate people how important it is to use PrEP, and also to empower young people to be part of the initiative of having safer sex practice, have communication with each other, knowing one's status, and being more proactive to stemming the tide of HIV. This is our moment in time to do so, and we want to thank all of our partners. And again, CEO Fields, we want to thank you for continuing to keep this at the top of our conversation as we move forward to have an HIV-free environment, not only in the borough of Brooklyn, but in New York City, New York State, and throughout our entire country. Thank you very much.
Thank you. And before we go to any questions, I'd like to have Doug Worth, who is President CEO of Amida Care, leading organization here and throughout the state. Doug.
Thank you, Virginia. So, good afternoon, everyone, and thank you for being here. And thank you, Borough President Adams, for your leadership, and of course, C. Virginia Fields and the National Black Leadership Commission on Health for partnering with us to recognize the state's launch of the first annual PrEP Aware Week. I'm Doug Worth, part of the Amida Care family. We have expertise in sexual health, HIV treatment, and prevention. Thanks to our governor, advocates, community providers, people living with HIV, and other public health officials, New York State has a plan, and we've made progress on our goal to end the HIV epidemic by 2020. Between 2017 and 2018, you heard the borough president reference 11% drop in the number of new HIV infections statewide. That's tremendous progress, but there's still much more work to do. And what's happening here in Brooklyn is a prime example. In 2017, 640 Brooklynites became newly diagnosed with HIV. That's up 10% from the previous year, and the borough of Brooklyn was the only borough to experience an increase in the number of new HIV infections. Since increasing access to PrEP is one of our greatest weapons in winning the war against HIV, there's much more we need to do to make sure that every Brooklynite knows about PrEP. PrEP is a game-changing pill, so tell your friends, talk with your family members, have conversations at work, and when you go to your house of worship, whether that's a church, mosque, or synagogue, or another house, we need to talk about sex, and we need to talk about taking care of each other. PrEP usage is on the rise in New York State. More people are accessing PrEP. But did you know that that the largest proportion of people accessing PrEP in New York State are cisgendered white men? And that's despite that in 2017, 80% of new HIV diagnoses were among people of color and people of trans experience. That's why PrEP Aware Week is so important. Healthcare providers, you play a critical role in closing the gaps and making PrEP awareness and access available to every sexually active person who needs it, particularly young men of color who have sex with other men, people of trans experience, and women of color. If you're curious about PrEP, or if you think it might be right for you or someone you know, pick up some literature today and go home and have a sexual health conversation, talk about the pleasure you want to have in your sexual relationship, and eliminate the risk of HIV by accessing PrEP. Thank you, everyone, for being here.
Thank you so much. And just before we go to questions that you may have for the Borough President, Doug, or myself, it's important to point out that PrEP is for persons who are HIV negative. in order to remain negative. So you've heard why we are here, and that is because HIV is still alive, and it is very much alive right here in the borough of Brooklyn. We're here because African Americans and Latinos still are disproportionately impacted. And we are here because during PrEP Awareness Week, we want to get the message out, especially to this population who may fear, out of lack of knowledge and information about what PrEP is, what the costs are, and how it works, so that we can educate. So education is important to knowledge and using it is important to prevention. So that is why we're here, and this is how we're doing it throughout the state and right here in the borough of Brooklyn. So if there are any questions for the borough president, oh, I'm sorry, we have another speaker. Four more? Okay, two more. Help me out. Dr. Birnbaum, come forward, please. Thank you.
Good afternoon. My name is Jeff Birnbaum. I am a physician. I'm the director of the HEAT program at SUNY Downstate Medical Center, my logo. And HEAT stands for Health and Education Alternatives for Teens. In reference to Ms. Field's comment on education, it's not just about medical care, it's about educating young people about health-related issues. Our program started as an HIV treatment program for adolescents and young adults ages 13 to 24. As many of you know, we are now in the End the Epidemic 2020 period, where we are revving up PrEP services. My program, I have a unique perspective from my program in that we serve young people who are the most sexually active and have the highest STD rates in the city and nationally. So they are a population that we particularly focus on to offer PrEP services. We've also run lots of PrEP forums across Brooklyn and at Downstate, where we invite the community, and we find out from taking surveys that young people actually do know about PrEP. What they don't know about is how to walk into a doctor's office, how to feel comfortable, where to go for a place that is safe, and how does this get paid for? So our whole program is set up to make people who are at risk for HIV and other STIs comfortable walking in and removing barriers around consent, confidentiality. How do you address if you're 17 years old and you want to go on PrEP and you're on your parents' insurance? How do you address that issue? How do you maintain your confidentiality? How do you get all this paid for? I just want to point out a member of my staff here, Mr. Damian Bird, who is our PrEP program specialist, whose job it is to help me sort through that with every young person who walks in the door. And most programs that are focusing on PrEP have PrEP specialists, PrEP navigators who are there to help consumers access those services. We just happen to have a special youth flavor with unique issues that younger people face. So I can't overstate the importance of having specialists. It's not just the medical providers, but specialists who know how to deal with all these navigation issues to get people into care for PrEP and get the services paid for. So people do know about it, but making that connection between what they know and how to get in the door is, I think, where we have a lot of work. I'll say one other thing. Medical providers tend to view HIV testing and offering PrEP as something that those HIV specialists do. Nothing could be further from the truth. PrEP treatment is easier to do in a clinical setting, and it's easier to treat than asthma or diabetes. Those are much more complicated treatments to offer in terms of what needs to be monitored, but doctors and other medical providers have a difficulty overcoming their own barriers to talking to their patients about sex. And this is something that we need to train younger providers to do from the get-go once they get into medical or nursing school or PA school, what have you. We need to make providers accountable for offering PrEP. Otherwise, those of us who are the HIV specialists will become overwhelmed, and patients won't get connected to us. They want to stay with the doctor that they know best and are already going to. So with that, I would like to introduce our next speaker, Octavia Wheeler, who is a community member who can talk about her own experience.
Hi, I'm Octavia Lena Koner, Wheeler legally, but I'm a patient with that uses Amida Care as my insurance. I was invited here as a community member to speak to PrEP's impact on my life personally, as I started PrEP when a provider at Callan Lord, through their health outreach to teens program, approached me about it. They explained what it was. They explained that if I'm on PrEP, the chance of me contracting HIV was drastically reduced to nearly 0%. And I thought that, whoa, this fixes so many of my problems, so much of my anxiety. PrEP radically changed my life for the better. Something that happened the last few years is that as a trans woman, I've started to see that I could be publicly loved, I could be nominated for an Emmy, I could be more than just an issue, I could be a person. This is counter to what I was told growing up, which was that I would get murdered, that I would be a failure, and that I would definitely die alone with AIDS. But that narrative obviously does not work for me. I'm not gonna do that. So I stand here because of my foremothers. I'm thinking of people like Sylvia Rivera, Miss Major, Marsha P. Johnson. Because of their living examples, because of their activism, their organizing, I can have a purpose in this world, and I can live a vivid, vibrant life. But I still need support. Some of that comes from media and culture, some of that comes from my family, chosen or otherwise, and an essential part of that is healthcare, health providers. Hormones have enabled me to fully live in my body with joy. PrEP is equally important to me as hormones are. I was raped in college. Fortunately, I was on PrEP, which, given the myriad disasters that I was dealing with, because of PrEP, I did not have to worry about a positive diagnosis. If it weren't for that one alleviation of that one stressor, I might have killed myself. I probably would have killed myself. In this way, PrEP was literally a life-saving drug. I'm not alone in this. We know that women, cis and trans, experience higher rates of sexual violence, domestic violence, and women and trans people and non-binary people and femmes that live with HIV are at a higher risk of contracting HIV. This crisis is heightened. PrEP ensures that me and other trans women have a tool that protects us against the virus. Some bodies are marked for premature death. PrEP is essential in just making sure that we can stay alive and that we're destigmatized, and so much anxiety around just surviving is just released from us. Through hard work and support, I'm thriving, and I know PrEP is an essential part of that. Thanks.
So we've heard the why. We've also heard about resources and services here in Brooklyn, and we have certainly heard about lived experiences from a person who is on PrEP. We've also been joined by one of our local city council members.
Matthew Eugene.
Right. Dr. Matthew Eugene, would you like to say a few words, Councilman? Yes, thank you.
Thank you. Good afternoon.
Good afternoon.
My name is Matthew Eugene, and I'm the New York City Council member representing District 40 in Brooklyn. It is a great honor for me to be here, and I just want to start by thanking and commend also Borough President Eric Adams for organizing this very, very important press conference. When I say very important, and I'm going to tell you why. And I want also to thank all the partners, Amida Care, National Black Leadership Commission on Health, and all of you who are here. You know that HIV/AIDS represent a very serious health issue, very serious, for many years. In the 90s, they were talking a lot about it, and a lot of press conferences all over the place, but they don't talk too much about it now. But people may think that it's over. It is not over. It is not over. It's still there. And many people are infected every year in the United States, about 40,000 or 50,000 or more. And around the world, about 4 million people. So that means we as a society, we as a city, we as government, we have the moral obligation to make sure that we do everything possible to prevent the disease. And that's the reason why it is important to come here today to introduce, to talk about this prevention measure for people to know it is possible to prevent HIV. It is necessary, it is very important to do it because it's a public health issue. When people are infected by HIV, of course they are going to have transmission. And many people are going to be infected and pay the consequences. But if the people, regardless of your situation, whether you have it, you don't have it, whether you are active or not, you got to make sure that you got to take the necessary measure to prevent that and to use that pill every single day. It works because people are saying that it works. We have research and statistics, that prove that it works. And again, if you are listening, if you are watching now, it is very important that you take the necessary measure to do prevention. And we know that the best medicine is prevention. And again, to all of you here, thank you very much. To our board president, thank you very much. To the all partners, thank you very much for what you are doing for the city of New York, for what you are doing for so many families. Because when one person is sick by HIV, the entire family is suffering. Thank you very much, and God bless you.
Thank you so much, Councilman, for your support and leadership within the City Council around this issue. Okay, questions?
How affordable is a drug like PrEP, and how are groups like Amida Care making it more accessible and more affordable for low-income communities?
So it's one of the reasons why we want people to know about PrEP is covered in the Medicaid program. So the treatment for PrEP, while it costs about $1,000 a month, that what we've been finding at Amida Care is that people will likely need access to PrEP for anywhere between 6 months to 5 years. And we're willing to pay for the cost of that medication to help people to stay HIV negative. Because if we don't pay for PrEP, then what happens? If people become HIV positive, the lifetime cost of treating HIV disease can be upwards of $400,000 to $500,000. So if you're a smart business person, would you be willing to spend maybe $50,000 on PrEP for 5 years and help someone to be well and get about the business of living their life and prevent the cost of $400,000 to $500,000? It is the socially responsible choice. It is also the right fiscal choice for the state of New York.
Thank you.
Any other questions? Okay, so again, on behalf of the Brooklyn Borough President and everyone you've heard from, we really do thank you, and we hope that you can carry the message forward about PrEP as a very important prevention tool. The services are right here in Brooklyn. The information is available, and we just need you to help spread the message. Thank you so much. And that ends the press conference.